Assalamu alaikum and hi everyone. Thank you for watching this video. In this session, we hope to answer some of the common questions that you might have regarding COVID-19 vaccination. What is the purpose of vaccination? It is to achieve some level of immunity and herd immunity in a safer way, rather than letting the infection run through the population, which will cause a lot of damage. Having herd immunity is like having a barrier of people that will help break the chain of transmission of COVID-19. This is the same concept practiced for decades to suppress highly infectious diseases such as measles. How does the vaccine work? Via the vaccine, part of the virus, in this case the spike protein, is presented to our body, which causes the body to respond by producing fighters or antibodies. This means that our body is mounting an immune response. So the next time we encounter the actual virus, our body will already have these fighters to protect us against the virus. The vaccine will either protect a person from getting the infection or prevent a severe infection from occurring. There are so many methods of vaccine development. I'm confused. Yes, there are many approaches that can lead to vaccine development. The vaccine can have a part of the virus in it, in this case a spike protein, or it can have a weakened or killed version of the whole virus. Similarly, this is how the vaccines that we have for other diseases have been developed. Or it can contain an instruction, that is the mRNA, which tells the body, meaning our body, how to make the spike protein. This is a new approach. Regardless of the method, the endpoint is the same, that is to introduce the spike protein to our body to mount an immune response. If the vaccine contains a part of or the whole virus, will I get COVID-19 infection from it? The answer is no. The particle or whole virus are so weakened that they don't cause disease in us, so you're not going to get the disease from the vaccine. Is the vaccine safe? Yes, the safety and efficacy of each vaccine candidate would have been established prior to administration to the general population. All the vaccine candidates will go through at least 3 stages of clinical trials to assess the safety and efficacy of the vaccines. Subsequently, for the vaccine to enter a country, approval must be sought from the respective national regulatory authority. At this stage, the authorities will already have the safety and efficacy data. They will then assess if the vaccines have gone through good manufacturing practices, quality control, and so on to ensure that the vaccines have been well made. Do I still need to practice physical distancing and wear a mask if I'm already vaccinated? The answer is yes. At this stage, we know that these vaccines protect people against the disease. However, it is unclear whether the vaccine protects against transmitting COVID-19 to other people. In other words, we really need to continue these precautions while we're still learning about what the vaccines can do. Is the vaccine safe for pregnant or breastfeeding women? The recommendation for vaccination in pregnant or breastfeeding women differs between countries or health agencies, and it is likely that the recommendations will change as more vaccines enter the market and as we have more information after the vaccine rollout worldwide. So it is important to seek local advice regarding vaccination in these groups. In Australia, for example, breastfeeding is not a contraindication to vaccination. However, for pregnant women, vaccination is not routinely recommended. Pregnant women may consider vaccination if they are at high risk of developing severe COVID-19 infection due to medical risk factors or high risk of exposure to the virus. Ultimately, the decision to vaccinate should be discussed with your healthcare providers. There are so many sources of information on COVID-19 vaccine. Can I trust all of them? Yes, there are many sources of information on the vaccine available, especially on social media. Unfortunately, not all can be trusted. So it's important to exercise care when looking for information on COVID-19 vaccination. I myself prefer to look for information from well-known health agencies such as WHO or from government agencies such as the Department or Ministry of Health, depending on where you are. So let's be smart about how you access and use this information and avoid spreading false information. Would you get vaccinated against COVID-19? Definitely. And I would also encourage my family members to get vaccinated too, especially the elderly in the family. Remember, we need a high percentage of at least 70% of the population to be vaccinated to build the herd immunity. So let's do our part. Thank you.